It is 11:03 on your Saturday morning. It's a beauty out there, and we are set to go here. Dr. Payne Show is here. Reach out anytime. You know how to get a hold of Dr. Lou, 1-855-55. Dr. Lou, DRLOU, info@paynecarecanada.com. And, of course, phone lines open, 416-870-6400, ready to go. You have questions about your health, about pain, about anything under that large umbrella that we cover here each week. Dr. Lou, we are ready to take the phone calls, and I know you're ready to answer them. So have at her on the phone lines. We're ready to go. What's going on with you, pal?
Not too much, John. How are you?
Cool. I'm good. I'm ready to talk about pain.
All right, let's do it. Let's go old school on this. Let's deal with spine-related pain today. Next week we'll have a special guest on, but we won't give away too much of what'll happen next week. But Dr. Amendolia, who is
amazing,
a director of the spine clinic at Mount Sinai, is doing some of the leading research on spine-related pain, specifically things like spinal stenosis, mechanical pain, and things like ankylosing spondylitis. So just an incredible resource that we're going to have here next week, answering a lot of things and giving our listeners essentially what where we are with low back pain. But let's start right now anyways. But next week we'll very much tailor towards the spinal stenosis. But for today, let's deal with low back pain in general. So, I mean, let's start with the fact that low back pain is I think the leading cause of disability in the world, which is tremendous when you think about that in terms of visits to hospitals and ER rooms. I believe it's second only behind the common cold, and so this is clearly something that affects. If you don't have back pain, you definitely know somebody who has back pain. And I don't mean somebody like a distant friend, probably a loved one or a family member, someone that you can almost point to right now. So back pain is incredibly, incredibly common and prevalent. Some interesting things around it is it's as prevalent in, rich countries as it is in poor countries. It doesn't matter where you go in the world. It is as prevalent everywhere as it is. So I believe the stat is something like 80% of the population at some point will experience spine-related pain. And again, this it doesn't discriminate against the rich, the poor, country to country, whatever it might be. It also doesn't. It hasn't changed much in the hundreds of years of data that we have around spine-related pain. So this is nothing new. This is nothing that, a lot of times we talk about, well, it's the life that we're living today. It's probably the life that we've been living in the last 500 years that makes it so prevalent. And so this is something that, affects all of us, essentially, is where I'm getting to. In 10% of cases with low back pain, we can identify a specific cause where we can say, well, it's due to spinal stenosis, or it's a disc herniation, or it's ankylosing spondylitis, some proper diagnosis. 90% of cases, we can't really figure out what it is. We just call it mechanical, non-specific low back pain or spine-related pain. And this could be a muscle, it could be a joint, but it's very, very hard in those 90% of cases to identify, is it the muscle, is it the joint, is it a combination, et cetera, et cetera, et cetera. And so, that's pretty, significant when you consider that the numbers that I just gave you, 10% of low back pain is what we are very good at identifying. And then there's 90% that we don't know. We know it's non-specific mechanical, so we know it's some type of the structures in the spine, but we don't necessarily know for sure which one it could be at any given time. And we'll have better ideas based on symptoms and testing and those things. But we're not always 100% sure. Now, that doesn't really matter too much towards the treatment, but I just think, it's something that people should be aware of, that in 90% of cases, no matter who you're seeing, even if it's me, I'm going to give you on that 90% what I think is the most likely, but it's very, very hard to be certain. And so this is something, again, that's affecting, millions and millions of people. It's not easy to treat by any means when you look at the treatment options available for spine-related pain. And we're going to talk about the 90% today, the non-specific mechanical pain, and we're going to stay away from the stuff we'll deal with more next week. Those things, there's options to treat that. There's injections, there's medications, there's therapies, there's rehabilitation. And it really comes down to, well, what is the best option for people? What should people be doing? And when we consider most people that have some type of episode of low back pain, they present to whomever they may present to, they're often prescribed a medication. the research would suggest that that's not the best first intervention. It's a physical problem which usually needs some type of physical intervention first. So medication, when we've looked at different classes of medication compared to other forms of therapy, whether it's manipulation or exercise or things, modalities, things like that, it's either not as good or as good as those options. And now the important thing to consider is medications come with sometimes significant side effects. Now, I'm not saying that medication is never part of it, because in some instances in the beginning, absolutely, it should play a role. But if you've been on, a course of medication for longer than 2 or 3 weeks for some type of mechanical back pain that you're having, and that's all you're doing, you're likely doing the wrong things. And that's a big deal. And you should be doing the right things. And again, I've said this multiple times on the show that a physical problem often requires a physical intervention. And so the interventions that are really supported, and we'll deal with, I guess, the low back right now, the interventions that are really supported by the research are things like the physical therapies, manipulation with a chiropractor or physiotherapist or whomever. Well, not whomever, that does matter who's doing the manipulation. Massage therapy, passive modalities like laser, ultrasound, those things in the beginning are very, very, very important, and they do help. However, going forward, there should be a transition of those passive interventions to more active rehabilitation. So what we really find is that it is the exercise after those stages, when we can get people out of that acute initial phase of pain, that doing those exercises and doing the right exercises is extremely important. And it's not just here's a sheet of paper and here you go ahead and do your exercise. It has to be specifically guided exercise for the patient, for them to understand. So this is a very, very prevalent, complex problem that we don't have great answers to. We do have management issues, but oftentimes, and I think you know this, John, people are expecting a cure for their back pain. So right. They hurt their back and they think, well, there must be a cure. No, that's not what the research and what my clinical experience suggests, that there really is no cure. It's really about management. So, for today, we're really going to focus on the low back. If you have calls, call with anything, but, I think it's an important topic to discuss.
It is indeed. Like you said, it affects so many people, and it doesn't discriminate. We'll get to those calls. Bring them on, 416-870-6400. Star 640 on cell, just getting warmed up. Dr. Payne Show, Global News Radio, 640 Toronto. You bet. It's 11:13. We got wide open lines here. You can also try 1-888-225-TALK. That is toll free for the remainder of the show. We are concentrating on this show, which we could probably do at least a segment every week we're on lower back. I think we
could probably do the whole show on lower back.
Well, yeah. It's each week, right? It's not really a scary statistic that you gave out there in the first segment, but more of an eye opener that it doesn't discriminate. It could be someone working in a field in Botswana or a guy on Park Avenue in New York. They could have the same back problem. It doesn't discriminate. That's scary.
Yeah,
that's really scary.
Yeah, and a lot of things. When you look at a lot of diseases that affect, they do tend to discriminate based on socioeconomic status, sure. Sex, ethnicity. There are things that are more prevalent, but this low back pain, even climate, right, could have an effect in those things. Right. But no, low back pain, whether you're in a warm climate, in a cool climate, it doesn't discriminate. It's something that is suffered from so many people around the world. And when you look at, I guess the question becomes, well, why? Why is it so prevalent? And you've said before that you think it's because we've stood up too quickly, and we've gone from on all fours to onto two legs, and I think that's probably a very good theory, actually, and I know that is one of the theories as to why, and evolutionarily and from an adaptation perspective, we probably just haven't adapted yet. And then oftentimes the things that life requires us to do, again, they don't discriminate from area to area and climate to climate. People have to sit, right? No matter where you are, you're sitting. You're often bending. You're often twisting. These are things that are sort of part of day-to-day life. So those things are not the best things for the low back. And so it's the reason why it's so prevalent. But you're right. It's an eye-opener when you consider, wow, this is something, when you consider how much goes towards so many other things, right? Like heart and stroke and these things, it doesn't affect nearly as many people. Now, I'm not suggesting we shouldn't have efforts towards that. Obviously, these are life-threatening conditions, but low back pain is one of those things that is affecting almost everybody, you could say, at some point in their life anyways. And when it is, there's, again, the solutions to it are not great, and the things that are mass marketed for low back pain are not great. And again, when you consider things like over-the-counter medications for these types of things, they don't really work based on the research. Now, do they help play a role if you're doing other things? Yes, I think it becomes part of a multimodal approach where it has to be part of it. But if you're having low back pain and all you're doing is taking a pill, you're likely not doing the right thing. I mean, throughout the years, what we found out is we do know some things really well. So, I guess when you look back 20 or 30 years ago, people would, quote unquote, throw out their back and then they would rest. We definitely know that not moving and laying down and sitting down is actually bad for your low back pain. And so that's not a good thing. So we know that based on research that not being active in those times is a dangerous thing. Now, that doesn't mean you're going to be going out for a run if you've got severe low back pain, but you also shouldn't be just on bed rest. And that was something that was prescribed once upon a time, was bed rest for these types of things. And that's not the right approach. It's absolutely not the right approach. And depending on severity, that's something that matters on how you treat it initially. I mean, I've seen people that are, we call them pancaked, where they can't even move. They're essentially stuck on their couch or their bed, wherever it was. I mean, in those instances, obviously medication is going to be your only option. Like when you're that bad, you have to get everything calmed down, inflammation taken out, all of those things, just to be able to get the person to move. And that's the important part, where it is important. But I mean, if you're somebody who's waking up every morning or experiencing just, call it that 5 out of 10 low back pain, and it's you can do everything you need to do, you have your range of motion, all those things, and you think taking a pill daily for that is going to help, it's not going to help. I mean, if it was going to help, you'd likely have no more back pain, but that's not what happens. Most people will say, yeah, I take an Advil every day, and yet I still have back pain. And so, it's not a great option. And again, when you consider the side effects of these things, especially as you move towards the harder classes, I mean, we all know about the opioid crisis, and opiates were not so much anymore, but they were prescribed very heavily for people with chronic low back pain or neck pain. And so, I mean, there's a lot of serious side effects to those things, and there are better options. And I mean, the best option when you look at the research consistently is education of the patient, so making them understand what they have going on, and then specific guided exercise is really the best long-term intervention. Now, all of the other things, the therapies, all very much play a role, especially in the beginning of these phases or in exacerbations of these phases. But if you're someone who has chronic low back pain and it's at that manageable level right now, but it's that nag that's there, your best option is the exercise component. And if you're not doing the exercise component, you're not doing the right thing. I had a patient this week who had, she came in, low back pain, started 4 or 5 month history. All of the signs, all of the symptoms she was describing, very much mechanical. As I got speaking to her, she basically said that, over the last few months, she's gained a lot of weight. She's stopped being active, and now all of a sudden she's got this low back pain. Well, that makes sense. Once you start changing your body that much, you decondition yourself, it is going to be likely that you will develop some type of low back pain. And I mean, when you look at the spine in general, and low back and neck pain are the two most common areas, whereas the mid back, the thoracic area, when it comes to mechanical pain, isn't as common in the absence of things like a scoliosis or things like that. But the reason really becomes because that area of the spine has the rib cage, which provides an inherent stability, whereas your neck and your low back are essentially, there's no structural support. All of the support is created by musculature and soft tissues. And so if there's a deconditioning or a weakening of those soft tissues, then all of a sudden your spine's going to move around more than it used to. And when that happens, even slight millimeters, degrees, all of these things set off a cascade in your brain, and it creates this constant symptom of low back pain.
We're going to take a short break and more of this conversation happening. We'd love to hear from you, whether you're suffering from back pain or you have questions about what we talked about already. Phone lines wide open, ready to go. 416-870-6400, star 640 on cell. You also have the option of 1-888-225-TALK. That is toll free. Lots more of the Dr. Payne Show just ahead. Global News Radio, 640 Toronto. Dr. Payne Show, 416-870-6400, star 640 on cell, 1-888-225-TALK. That is toll free. You want an opinion, ask a question. You got lower back pain. You're probably one of, literally billions of people that do around this planet.
80%. So, yeah, I guess it's in the billions for sure.
Well, yeah, a lot of us. Got Frank on line. Hey, Frank, good morning.
Good morning. How you guys doing?
Good.
Good, pal. What's up with you?
I've had 2 motor vehicle accidents causing me a lot of pain to my lower core and back, and it's got me to the point where I could have a hard time walking. I got to sit down after a few minutes and just get like a burning, really hard pain in my lower back. I just wanted to find out what kind of options are available to me to try and correct it. I am overweight and I have knee issues, which has prevented me from doing a lot of exercise and walking.
So what have you done? Like, when were these accidents, Frank?
The last one was a few years ago.
Okay, and the one before?
Was about 2006 or 2008. And
they were significant impacts?
Yeah, I had to go through months of rehab because I had a hard time with my back step at both of those times. Okay,
and are you still doing rehab?
No.
Okay, well, that right off the bat is the first problem, right? So the way low back pain, so number one, obviously, we just talked about how prevalent low back pain is just regularly, right? So obviously after something like 2 significant car accidents where there's a significant amount of force, not just significant underplays how much force is going through your body, there's obviously going to be changes that happen in your body. So let's underscore that by saying this is not the regular type of pain when you're dealing with car accidents, because this is obviously going to make things probably worse. But again, going back, and let's accept the fact that you have low back pain, which you do, and let's also accept the fact that you're never going to cure it at this point. This is not something that you're going to one day do something and magically your back pain is gone and you'll never hear from it again. That's not going to happen. No. But what does need to happen is a good analogy is thinking of something that people are more familiar with. I guess let's take diabetes. If you were diagnosed with diabetes for whatever reason and you were told, hey, listen, you have to be on some type of medication to help control your glucose, something like a metformin, that's like, here you go, take it once or twice a day for the rest of your life, because that's how you're going to manage it. Plus you have to do exercises and et cetera. You educate the person around that. Those rehab exercises that you showed in the beginning, right? Those are not things that are meant for a 6-week period or a 3-month period or a 7-month or whatever. It's meant for the rest of your life. That is your prescription to keep now your back pain, which is equivalent to diabetes, in control. And if you're not continuing to do those things, then you're already on the wrong path, because as soon as you're not doing it, you're only making yourself worse. So that's a fact that needs to be accepted by people who have low back pain, that the prescription of exercise is not something that is a temporary solution or something that is has a half-life or some type of expiration on it. No, this is something that you need to continually do. And that's very, very important. And I understand that, you just mentioned that it might be tough for you to exercise and do things. This is why exercise with a guided professional. This isn't, when I say exercise, I don't mean, just print off a sheet of paper and start doing whatever exercise. Guided exercise is important because a professional will work with you to work within your limitations, to start you're going to crawl before you can walk, and those types of analogies. So it's very, very important that you're working with a professional who's showing you the right things that you could be doing and making it progressively harder as time goes on. That's another very important thing. A lot of people say, well, I still do those exercises that I was doing 6 years ago. Yeah, but you're doing the same amount, the exact same exercise, same intensity, et cetera, et cetera. Your body adapts. Your body adapts to things every 2 or 3 weeks. So as soon as 2 or 3 weeks have gone by and you haven't changed a little bit of what you're doing, your body's adapting and just getting used to it. And that's what graded rehabilitation is. It's a guided exercise program that prevents adaptation of your body, and it starts at the beginning, getting the simple things strong first, all the way to getting everything strong together. So that is a very, very important thing that you have to be doing is really getting that exercise component consistently. And I mean, it's very important to also understand hurt versus harm. So a lot of times people with pain will say, well, I don't do that because it's going to hurt me. But not everything that hurts is going to be harmful. And a good example of that is when you exercise, you'll have an inherent amount of pain that happens because your muscles break down and they have to be rebuilt. That's not harmful pain, though. It's hurt pain, but it's not harmful, versus not doing anything may not hurt you at all, but it's very harmful. So there has to be an appreciation for the difference between those two things, and that's hurt versus harm.
Right. So I also have another underlying condition. It's the fact that I'm a long-distance truck driver.
I'm sorry?
I'm a long-distance truck driver, so I spend a lot of time sitting behind the wheel.
Yeah, exactly. And so none of those, that doesn't help your prognosis for sure. But again, that's where, a professional who understands your work takes that into consideration and can give you things to do to offset that when you're not driving. And I mean, it's not the perfect scenario, right? Like if you had to choose, can I treat somebody that has low back pain that drives long distances or not? Probably the one that doesn't is maybe a better person, but this is the reality of your situation. So we have to work within the parameters of that situation, and it doesn't make it impossible to manage. It just simply makes it harder.
Okay, I'd like to be able to come and talk to you
Sure.
more. Is there a number I can call you at, or
Yeah, you bet. You bet there was, Frank. Write this down if you have a pen handy. We give it out throughout the show anyway, so keep listening. If you don't get it, it's 1-855-55 Dr. Lou, DRLOU, Dr. Lou, or email info@paincarecanada.com. We'll get to more of your calls. Frank, appreciate yours. Lines are open 416-870-6400 *640 on your cell, or 1-888-225-TALK. That is toll free for the remainder of the show here. Dr. Payne Show, Global News Radio, 640 Toronto. Dr. Payne Show, still time to speak to you about your issues, lower back or otherwise. By the way, you want to reach out to Dr. Lou when the show is not on, 1-855-55 Dr. Lou, DRLOU, info@paincarecanada.com is also a good source. Roland, thanks for calling in this morning. How are you?
Good, you?
Good, pal. What's your concern?
My concern is, I've had hernia done in 2006 and again in 2013, and it was fixed with mesh.
Okay.
And everything every problem that I have, like muscle cramping, and it pulls my hip out, it pulls my lower back out, I got a vice grip in there.
Okay.
And it's crippling.
Right.
And when I go to the doctors, they just give me these heavy-duty muscle relaxers and Tylenol 3s. I could chew them like Smarties, but I don't.
Right.
I just stay away from that. I got prescriptions I haven't even handed in.
Mm-hmm.
And I'm just wondering, is there a problem with this mesh in men with hernias?
I'm not aware. I don't perform. I don't do those types of procedures. So I'm not sure. I'm probably the wrong person to ask on what the options are. I mean, from a general healthcare perspective, I would say that number one, you I guess have seen surgeons before. What have they suggested in terms of what's going on?
Well, the last doctor I went to, they're talking about removing it, and I'm thinking, excuse me, that'd be a bigger problem than just leaving it alone.
Okay. Well, what makes you think that?
Man, I just think that, the 2013 repair was a repair on a job that was done in 2006.
Mm-hmm.
So it's like I got a J-cloth stuffed in there, eh?
Okay.
And it's crippling. It's unbelievable. I do chores, and if I'm not careful, it just can cramp up on me, and I can be really down and out because it just spasms the muscle.
So it sounds like your issue is, and correct me if I'm wrong, is that you're being given medications to manage this, and you don't want that option. They've suggested maybe going in and repairing it or replacing that, and you don't want that option. And there probably isn't a lot of other options. So what are you sort of looking for?
On this Monday, I actually have an appointment to go to a physiotherapist.
Okay.
And hopefully I'm thinking I need to do certain stretches to keep that area stretched out and loose and supple. I don't know what the word is.
Yeah. I mean, that probably won't hurt.
And then to strengthen that area, and that's my next step, right? So.
Yeah, well, I think, if that's not a step that you've already entertained, it doesn't sound like a bad option. So I think that's important. Yeah. Have the people that did the surgery, have they recommended that you should be doing that?
No, I really don't want to go back. I really don't want to go back to the surgery. Well, I'll tell you, when I had the last surgery, I was off for 8 months, and I never could figure out what went wrong, and I'll never find out. But it was not fun.
Right.
And I have another hernia on the other side, which I don't even want to touch it. Right.
So what's predisposing you to all these hernias?
Well, I've done a lot of heavy work, like the commercial equipment mechanic, right?
Yeah.
So that's been my line of work over the years in commercial equipment. Yeah. And so I'm retired now. I'm at 59 and retired now. So I just want to get by, do things and with the exercise and stretching, and maybe I even got to do yoga. I don't know, but
well, I mean, I can't comment on what you should be doing from that perspective. I mean, if you have an appointment on Monday, I think it's good that you're getting assessed by a professional. Make them aware of the extent of everything that's going on, and you know, as long as it's an option that is viable for what you have going on, I don't think it's a bad thing. I think, though, you know, you highlight a couple things where, you know, when you don't want to go back to see the surgeon, and a lot of people feel that way, but, you know, just because you see a surgeon doesn't mean you have to have surgery. It also means getting the other approaches that they might think are beneficial. And I mean, when people say, I don't want to do something, you know, you should be basing those opinions too on some type of research that you've done, not just simply on, you know, just a thought. So, you know, and I think that's an important thing to consider. No surgeon is out there looking to hurt anybody. All they're trying to do is help everybody as much as they can, and they do a tremendous job at that. And unfortunately, everything has a risk, especially, I mean, non-invasive procedures like physiotherapy that you're going to do have a risk. And if a non-invasive procedure like that has a risk, imagine what an invasive procedure like surgery has. And so they do a lot to mitigate those risks. There's a lot of things that go into it. These are, you know, surgeons are some of the most brilliant people that we have in society for that very reason. And so, but nothing is foolproof. There's nothing that we have in healthcare that's 100%. And so it's things can always go wrong. And I think it's also about, you know, making sure that, you know, I speak to a lot of people, and when I ask them questions, what was told to you, what was recommended, the answer is like, I'm not sure. And I think the onus falls on the person. You have to be aware. You have to do your job to understand the extent of everything going on.
Oh yeah. But in the time that you've been working, have you heard of any problems with mesh in men with hernia?
I've never dealt with that issue. No.
Okay. Okay, well, I'm just going to get to the physio and do my exercises and to strengthen that area. That's the next step. Anyway,
good luck.
So.
Thanks, Roland. Appreciate your call moving forward. I'll give you Dr. Lou's number anyway, 1-855-55 Lou, DRLOU. info@paincarecanada.com is the email. We'll take a short break here. Lots more to go. You have a phone call. Bring it on. We'd love to talk to you. 416-870-6400, star 640 on cell, and 1-888-225-TALK. That is toll-free. This is the Dr. Payne Show. Global News Radio 640 Toronto. It is 11:43. Yeah, you still have time to call in. You can also use 1-888-225-TALK. That number is toll-free. You have any health or physical problems, bring them on. We are kind of focusing this show, Dr. Lou, on lower back because it's like pretty much everybody at one time or another, well, whether either chronic or not, has had lower back problems. And it's interesting how widespread this is. And I think, you know, we hear a lot about, you know, how our diet is so poor and there's so much obesity in the world now, especially in North America, which that is true. But the offset of that, I think, and we've talked about this before from a nutritional standpoint, we are living longer than we ever have. I mean, people even in sub-Saharan countries now are making it into 70s and 80s in some cases. And we've often taught that maybe the lower back is part of a mechanical system without the support of a rib cage, like you said, for the thoracic spine. Maybe it's like a tire. You know, it's only got so much life in it. And the back's saying, hey, I was meant to last about 45 years here, not 90.
Yeah, and I guess what also matters is, you know, like a car, how fast do you go through that? You know, if there's an inherent amount of, call it mileage, that your back has, some people might go through that much quicker than other people, right? Like, there are some people who live their whole lives and experience no back pain whatsoever, which is incredible. Like, you know, I mean, you've suffered from low back pain. I've suffered from low back pain. Jody, back pain? Yeah, see, there you go. So, you know, there's three of us, and we're at 100% so far. So, I mean, I'd almost love to hear from someone who's listening. If you've never had any spine-related pain whatsoever, that being neck, upper back, or lower back. Like, no spine-related back, no sciatic, no nothing. Like, it would be incredible to talk to somebody that has never experienced that, because I think almost everybody has at some point. And so, yeah, I mean, you're absolutely right. We're living longer, which is not only the only reason for low back pain, but that's why every disease becomes more common in humanity now. Like, you know, when we talk about, well, there's an increased rise of cancers and heart disease. Well, yeah, of course. Like, I mean, as we live longer, something's going to have to kill us at some point. And so we can't battle everything off forever. I think what's important to look at is, are we able to offset the age of where those things are happening, right? So, like, you know, if we take, I don't know, we can pick a cancer like prostate cancer. Can we push the age at where it starts to become more common? And low back pain. But again, low back pain doesn't even discriminate with age, right? Like, there's just as many young people that are, it's pretty, I guess, it's not as common, you know, under the 21-year-old mark, that type of thing. And oftentimes when things do happen in that, you're that 10% where it's easily identifiable, right?
Right.
It's that 90% of non-specific pain that is the area that it becomes much harder. And so when it does happen, you know, those times when you're younger and there's things going on, the cause is more identifiable. And obviously, as time goes on, it is more likely that you will experience low back pain. The causes differ, though, however, right? So, you know, if you're under 45-ish, then things like the disc herniations are going to be much more common, where that's not very likely in the older population. If we're talking about 60s and 70s, that we're probably dealing with severe arthritic change leading to stenosis. Exactly. And so that's very important too. But yeah, I mean, whatever the age is, it's common everywhere, except, you know, again, if I see anybody that's under 21 and they've got, you know, chronic low back pain, I'm investigating that, and I'm investigating for everyone, but I definitely want to make sure there's nothing going on in someone that young. And you know, the other thing is, back pain could be a symptom of some very, very serious things going on too, right? So it's also always important. Although 90% is the non-specific mechanical pain, it's you can't diminish that. You know, sometimes in that 1% of cases, it could be something life-threatening. You have to be able to identify that, and the people that you're seeing need to be able to rule in and rule out those things first and foremost.
Yeah, it's funny you mentioned 21. That's the age that mine went right in the crapper. It's been a fun 27 years since that.
Everything's been in the crapper for you after 21, buddy.
Yeah, we won't go there this show. 416-870-6400, star 640 on cell. Get to Frank. Hey, Frank, how are you? Good morning.
Not bad. Yourself?
Good. What's going on with you?
For the past few years, I wake up with like tense necks, my jaw's cracking, and then it just ruins my whole day. It just makes me tired the whole day.
Right.
I'm always suffering a neck. Like, I tried mouth guards. I went to the dentist. We did all that. Nothing worked. Nothing. It's like constantly neck pain and jaw pain, and we can't figure it out.
So you've only seen a dentist for this?
I seen a dentist. We went to massage therapy. The massage therapy actually hurt me even more. I would leave the massages, and I would have headaches for days.
Okay.
And I've changed pillows. I don't know if it's my sleeping habit.
Mm-hmm. Does it wake you up at night?
I wake up. I feel myself tossing and turning all night.
All night.
So my sleep is very, very rough.
Any other weird symptoms that you have going on? Weird fevers, night sweat? No, nothing like that. You're otherwise healthy. No significant weight loss in the last 30 days. Nothing like that.
No, nothing.
Yeah, I mean, oftentimes jaw pain is related. So if I could show you the skeleton and I could show you how close the jaw is related to your neck, it's right there. Like, any change in the neck will affect the jaw. And so a lot of the times neck pain or neck issues, neck dysfunction, let's call it, doesn't necessarily have to be felt in the neck. Sometimes we can feel that in the jaw. And so it sounds like that is your issue. I mean, I can't say certainly, obviously, over the phone here, but
I've had the dentist pull out part of my wisdom teeth, saying it could be a wisdom teeth, and then it just makes me tired all day because I have like a very restless sleep, and then the pain in my neck and my jaw all day.
Right. No, I understand. So I think what you need to do is get this assessed properly by someone who might consider the root cause being the neck, and go from there. And I'm happy to do that for you, Frank, if you want to give me a call off air, and we set up an assessment, and we
go. Is there something I can do in the meantime, though, until I see somebody that maybe might help?
Well, I mean, what's your day like? Do you sit mainly throughout the day? What's your overall upper back and neck posture like?
I believe I'm more hunched.
More hunched. Yeah, so I mean, I hate to say have better posture, because people often, when you tell them that, all they do is straighten up, and that's not necessarily better posture for
posture. I sleep on my stomach.
Yeah, that's bad. that I could tell you right off the bat. You got to change that if you're having neck pain. How
do you change that?
Well, that's a hard question, Frank. How do you change a habit, right? Like, that's as hard as how do I quit smoking. It's not something I can give you. Just a one-liner. It's you got to break a habit.
When I go to bed. I start off on my back, but then I say I can't fall asleep, so I just turn myself around.
Right. Yeah, I mean, hey, when you're dealing with pain issues, sometimes the answer is not easy, but it's the answer. So I could tell you, sleeping on your stomach with your neck turned like that is not going to help your neck.
Frank, you want to follow up? No problem. Give Dr. Lou a call, 1-855-55-Dr. Lou. Go see him. Get it happening. info@paincarecanada.com as well. Still a few minutes to go. Squeeze in a phone call or two. If you have concerns or questions or comments, we'd love to hear from you for the remainder of the show. 416-870-6400, star 640 on cell as well. Dr. Payne Show, Global News Radio, 640 Toronto. Winding down the last few minutes here. If you want to try to squeeze in a phone call, you got some time. Give us a call, 416-870-6400, star 640 on cell. When the show's not here, of course, Dr. Lou, you're running a business. You're doing things, helping people. 1-855-55-Dr. Lou to get in touch. Book an appointment. Go see him. Get things happening. info@paincarecanada.com. I think that an important thing there is, I think a lot of people, when it comes to the lower back, is they'll start some sort of therapy, either mild or intrusive therapy, physical therapy, like you said, how important that is. And all of a sudden it's like, first couple of times it hurt. It's not supposed to hurt. I'm going to stop.
Yeah.
That's incorrect.
Yeah. Oh, a big thing that I think is a problem is if, like, people don't necessarily do that with a car, right? Like if you had a car and you took it in to get some type of service and there was something you didn't understand, something's happening, you would call back right away and say, hey, what's going on?
Right.
For whatever reason, people, when it comes to therapy, like you'll do, and you're absolutely right, that is not that uncommon. It's like they start something. Now, it should be the job. I make sure I really always reiterate to my team, you got to give people the reality of the beginning. Even when I tell people, when I'm referring them for something like therapy, I often tell them, hey, you're going to feel probably a little bit worse before you feel better. That is part of the process. Here are the things that are within normal limits, and here are the things that, if you're feeling these are not the normal limits. These are things that need to be taken care of right away. But you should communicate back with the people that you're seeing. That's so important to let people know, like, not just for yourself, but maybe they're doing something that's not right for everybody, right? Or maybe there's a miscommunication in the way they're telling people, so that maybe they'll change it. But I encourage everybody, if you're seeing somebody and you think, oh, that didn't work or not, go back and see them and just let them know the truth. That is so important. Just, hey, I did not feel any better. I, in fact, felt worse. Let them know. Maybe it's part of their game plan. Maybe they've missed something and they need to reinvestigate. Like, give people at least a fair chance, right? Like, don't just disappear after one or two treatments and you don't call them, you don't go see them. And not the vast majority of practitioners out there are very, very good practitioners. And so they're just out there, same thing, trying to help people. And when they're trying to help people, you need to communicate back what you're feeling in your body. And equal to some people who do that, you have the other people who don't feel better and they'll just come in, and because they feel bad, I'm feeling better. I'm feeling better. And it's like, well, don't lie.
Right.
Don't lie about what's going on. Just be honest with the practitioner.
It's amazing. It's like you said, you'll go to the cleaners with a white dress shirt with a stain on it to get out. You'll bring it back home. They didn't get the stain out. You don't leave it. You march right back there and say, why didn't you get this stain out? You should treat your body the same way. Right?
Yeah, absolutely. Like, to me, it's just never made sense that people give up on things right away. And it's like, oh, that didn't work. Like, you go see somebody and it's like, no, some things are bogus out there. Let's caveat that. But some things are not bogus. They're just doing the right things. I had somebody that came and saw me. They had tennis elbow going on, and I was able to diagnose it, and they had already been diagnosed with that, and they said they were getting treatment. I said, well, how many treatment sessions did you do? And they said 2. And I said, 2 when? Like in the same week? They're like, no, like 3 weeks apart. It's like, well, no, of course you're not going to be better. And I was like, did you continue for the going for treatment? No, it wasn't working. Well, yeah, of course it's not going to work. Right. You have tennis elbow and you think 2 treatments 2 or 3 weeks apart is going to do anything? Like, no, it's in fact probably going to make you feel worse because you're creating some type of micro trauma that never has the chance to heal properly. So, I mean, physical treatment, therapy is equivalent to medication. If you've got a bacterial infection and a doctor's telling you, here, take this antibiotic 2 times a day for the next 10 days. If you don't do that, you're likely not going to get rid of the infection. Well, therapy is the same thing. If you've got a practitioner saying, hey, I need to see you 2 times a week for 3 weeks, in that time this is the what we're expecting, then you got to follow through with that. And I also, for practitioners who are listening, I encourage you, make sure you're communicating this stuff. A lot of people get backlogged and they're just like, everything's quick. It's like, okay, I'll see you next time. It's like, no, sit there and explain to your patients. And that's what we do differently in my organization. We explain everything to the patient.
Good for another week, my friend. It's like you said, sometimes it's taken a lifetime to create the problem, so give it more than a week to get rid of it, right? You want to contact Dr. Lou Simple as we wrap here until next week. 1-855-55-Dr. Lou, DRLOU. Email to info@paincarecanada.com. Till next time, this has been the Dr. Payne Show. It's right here, Global News Radio, 640 Toronto.